Hi, I'm Jack Cush. I'm from the Baylor Research Institute in Dallas, Texas, and I want to talk to you about this interesting data that was presented at the ACR 2015 meeting. It's abstract 3110 by Gottenberg and colleagues, and it's the results of the ROC trial, also known as the rotation of TNF inhibitors or change MOA trials. It's an open label trial, but prospective randomized control trial where patients are not doing well on a TNF inhibitor and then are randomized according to doctor choice to either receive a second TNF inhibitor or another non-TNF inhibitor MOA, such as abatacept or tocilizumab or rituximab. And this was a 300 patient trial. 146 patients were ultimately seen in both groups. And again, the choice of therapy was made by a decision between the patient and the physician. As you can see in the top right-hand graph, that the patients in green did better. And who were they? They were the patients who received a non-TNF inhibitor biologic. While the responses to the second TNF inhibitor were good at 12, 24, and 48 weeks, roughly around 50%, a number that actually has been seen in a number of other open label trials, those changing to another MOA seem to do better with responses above 60%. And this also has been sort of a trend in recent trials. Again, it's not known in these trials whether patients didn't always do well for a primary or secondary loss of response or toxicity, but in general, this comes up. We need to change to another therapy. What do we choose? So I think that this is highly instructive, and this is the takeaway message from this particular report. They also did some sub-analysis of those who had anti-drug antibodies, and in the bottom right you see only the patients who took a second TNF inhibitor and what was the influence of anti-drug antibody. It turns out that in orange, the anti-drug antibody patients did better. Now, again, the numbers here are very low. 32 out of 278 patients had anti-drug antibodies, only about 11%. And it did color the clinical picture somewhat, but not in a major way. And again, I think this underscores that anti-drug antibody testing in our patients with our drugs turns out to not be a useful procedure. The takeaway message is that non-targeted TNF inhibitor, other biologics seem to do better when used as the second choice after failing a first TNF inhibitor. That's it. Tune in for more videos here on Treg.